Transfer Process to a Burn Facility, written by Rebecca Coffey and Andrea Bigley, presented by Andrea Bigley. The objective of this presentation is just to identify the necessary information required to safely transfer a patient to a burn facility. So obviously we're most concerned with some of the documentation, aside from obviously the patient being transferred. But we want to make sure that the transfer records include information about the circumstances of the injury, as well as the physical findings and the extent of the burn. Any flow sheets that document the resuscitation measures that are completed prior to the transfer should be included. Any records about history or documentation of treatments or medications would definitely be helpful. If the patient does have any kind of advanced directives or durable medical power of attorney, anything like that, that should also come with the patient to the burn center. Here's a sample of a transfer form that could be used. This is actually taken from the American Burn Association website. It's there for your reference if you ever need it, but obviously any information about the patient's demographics would be important, their TBSA, associated injuries, allergies, current meds, whether or not tetanus was given, if the patient has an inhalation injury, whether they're intubated, circumferential burns should be noted, how the pulses are currently, if there was any procedures like an escharotomy or a fasciotomy performed and where it was, did the pulses get returned after those procedures, IVs, fluids, urinary output, all of those things are important when you're transferring the patient. So the transfer process really isn't much different than transferring to any other facility. The ideal situation would be a physician-to-physician transfer, nurse-to-nurse transfer, providing as much demographic and historical data that's available. Any results of the assessment, interventions, labs, radiology, anything of that nature should be reported. The burn center and the referring physician will work in collaboration and make sure that the decision and the mode of transportation is the best for the patient. So in summary, for a seamless transfer, include all the pertinent documentation that clearly tells the story of what happened to the patient prior to the transfer of the burn center.